People are moving away from a survival mode. So people got into a survival mode and they downgraded their purchases. So they're moving out of the survival mode, which means people are moving from value for money products to value added products. If you look at the population division in Sri Lanka, now Gen Z is 25%, which is nearly equivalent to millennials. Gen Zs have an access to social media. So they're very much aware about what's happening globally, across. They're very aware consumers. They read through every label, they go through every ingredients, and hence they are open to experiment more. They're more demanding than the earlier consumers. And hence the kind of products that or kind of value addition that earlier used to happen, that paradigm has to change.
Welcome to Times Online. Today we have with us Mr. Ashish Chandra, Group CEO, Hemas Holdings PLC, to discuss about the company's performance and the way forward. Welcome to the show, Ashish.
Thank you.
Sri Lanka and the global economic environment is facing a major crisis in terms of the West Asian war breaking out and potential economic crises after that. What is the outlook for Hemas in this context?
So I think this is a very relevant question that you're putting up to the current context. For long, the Sri Lankan economy was going very well. We are growing at about 4 to 5% per annum. GDP, foreign exchange rates were pretty stable. Inflation was a healthy lower single digits. Things were going pretty fine. Consumer demands were growing up at about 7 to 8% per year. This Middle East crisis which has happened has put on a temporary break to it, but I still believe this is not going to be a very long-term impact. I'm hoping that it remains a small impact. From a Hemas perspective, it has 3 or 4 primary impact on our business if it continues for longer. The biggest challenge that we have currently is of the raw material supplies, because a lot of our products that we consume, which is on the FMCG side, like soaps, shampoos, hair oils, and on the pharmaceutical side, what we manufacture in Morrison, there's a lot of raw material that we procure from outside Sri Lanka. Now, availability of raw material is becoming a concern because a lot of the raw material that we use are the byproducts of petrochemical things. Then similarly, some byproducts are required for packaging, like bottles, the plastics, the pens that we produce in Atlas has an impact. So our biggest concern as of now is to secure supplies of our raw material for next 1 quarter. Obviously, the price of raw material is also going up, and we are seeing that depending upon the criticality of the raw material, the prices have gone up from 10% to 50%, as high as 50%. So that's another big challenge that the industry as such is facing. Second impact on us is on the foreign exchange. We spend a lot of our purchases happens in the US dollar denominations. As of now, I would say still the fluctuation isn't too much, but if this war continues for long and there's an impact on the dollar LKR value fluctuations, then that's going to adversely impact the business over a period of time. Third thing is the energy availability, and currently the fuel availability is critical to us. And we use fuel from 2 perspectives. One is to run our establishments, which is like running your factories, running hospitals. Till the time the power is not a concern, that's still not a big concern for us, because the good point in Sri Lanka is that we have availability of power as of now, and hence we don't have to use the fuel. The biggest challenge that we are facing currently on the fuel is about servicing the market, because most of the people that we have, our sales team, our medical marketing team, our servicing team in the market requires fuel to service the market and to give the shipments to the retailers, to give shipments to the supermarkets and other stuff, and even to collect lab samples, bring it back to the hospitals. So that is becoming a challenge with the new QR code system, which rightly being put by the government to control the consumption, is impacting the serviceability of the market. So we have to relook at the entire operation, the way we are running the operation in the field, so that it becomes much more fuel efficient for us. So these are the primary impact that we are seeing as of now. But as I said, these are temporary. We are hoping this war is going to end. And if it's going to end in next few weeks, about 3 to 4 weeks, then I think the country will be able to recover back with not much of an impact. But if this continues beyond 2 to 3 months, then this will have a larger impact over the business of ours. And this, if continues for longer period, will lead to secondary challenges. And secondary challenges is probably with the prices going up, inflation coming into picture, the demand may soften up over a period of time. So that is something which will industry is going to see. And if it continues for even longer, then availability of fuel will become a problem. Even availability of electricity will become a problem, and that will again has an impact on the industry as such. I hope we don't reach that situation and things come to normalcy much before that. But as we speak about Hemas, in a short run, we are well prepared for all of this. And I don't see any adverse impact on any results, which is something which is going to come in the near future.
How many verticals does Hemas have?
So we operate in three major verticals. Our first vertical is the FMCG, or what we call as the consumer vertical, where we operate Hemas consumer brands, which is mainly into the home and personal care. We have a learning segment, which is a brand we run called Atlas. And then we have our operations, consumer operations in Bangladesh. So that falls a part of the consumer vertical for us. Then we have a life science vertical, which mainly involves pharmaceutical manufacturing, pharmaceutical import and distribution, and hospital, which and the lab chains. So that's something that we run. And third vertical that we run is we call as a mobility vertical, where we have maritime services, where we run operations for Evergreen, and we are the GSA for Emirates here, which is mainly airline ticketing and cargo. These are three major verticals in which we operate, and then we have few strategic investments, small investments across. So these are the ways that how we have organized our organization.
During this quarter, how has each of these verticals performed?
Our businesses are very seasonal and they are very complementary to each other. So it could be a high season for one business and low season for another, and vice versa. At the last year, 9 months as a whole. If I start with our consumer vertical, which is the consumer brands that we have, our consumer brand is going through a transformation phase. So we decided to change the course, the way we operate on the consumer brand about 2 years back, or about probably 1.5 years back, where we said we will start focusing more on the value-added brands. We will focus on products which are premium products. We will operate in the markets and in the product categories which are underdeveloped or underpenetrated categories, which means changing a lot in the business, which means changing a supply chain, changing production, changing distribution, communication to the consumers. And I think that's the work that we had been doing over last 6 to 8 quarters. Okay. And I'm happy to say that that's something over a period of time we have been able to achieve. So consumer vertical, after 2 years of flattish growth, is now started to grow again for us. And we are seeing a very positive response in terms of the volume growths, the value growths, our market share growth in every category that we operate in. On the healthcare side, overall for last 2 years, including this year also going forward, is performed exceedingly well for us. It's nearly growing at about 15 to 18% year on year. And it is mainly driven by the increase in the volumes, which is coming because of the changing aging profile of Sri Lanka. Okay, and we are seeing a huge growth happening both in local manufacturing that we do under Morrison, or the imports that we do under Hemas Pharma. We see a large increase in the volumes even in the hospital side, which is the services side of ours. And mobility vertical is also doing good, and that is mainly because of the role that Sri Lanka is playing in the world logistic value chain. That's also growing at about 15 to 20%.
What is the outlook for these sectors in the coming quarters, especially in the wake of this whole global turmoil?
Huge inflationary pressure on the costs which happened during the economic crisis, where the consumer has actually downgraded their purchase behaviors, and they have gone for mainly value for money brands, smaller packs and other stuff. Last 2 years had seen that demand coming back. With the income stabilizing across Sri Lanka, people are coming back to the premium brands. They are coming back to value-added brands. They are coming back to the discretionary purchases. And that is something which is positive for us. We are also seeing a volume growth, and we are hoping that in the year to come that volume growth will continue. And if this Middle East crisis does not continue for long and create a larger disruptions in the economy, this trend will continue, and we foresee that the consumer brands will continue to grow for us in the next year, especially led by the value-added category and the premium category. There is a momentum in the healthcare side for increased demand because of the changing demography of Sri Lanka. Sri Lanka is, as a percentage of population, we are the second oldest country in Asia by 2030. 1 out of 5 person in Sri Lanka in another 3 years will be over the age of 60.
Silver tsunami.
Yes. And that brings a very different kind of challenges to Sri Lanka, because then what happens is when the population start aging, the kind of healthcare service that you require there is very different, because these people who goes beyond 60 suffers from more like a non-communicable diseases, which is cardiac problem, respiratory problem, neuro problem, diabetic problems, which has a long-term care which has to come into picture. It's not that you take few medicines and within weeks you're okay. Once you develop any of these ailments, you have to virtually take the medication for the rest of your life, and then you need a longish care which is needed to be done. Currently, in the healthcare service side, private sector only is 10%, 90% is actually being delivered by the government sector. And with the more aging population, I think the private sector has to play a larger role, and that's where Hemas come into picture. We have invested in the hospital. We are now also investing in the hospital to expand it beyond its capacity. We are investing in our local pharmaceutical manufacturing under Morrison so that we can produce affordable drugs in Sri Lanka, which can be supplied to the consumers in Sri Lanka, to the patient in the Sri Lanka, and they get the best of the world at a most affordable prices. So we are very positive and bullish about the healthcare sector going forward. The only challenge which probably a Middle East crisis may bring in, if it continues for long, is the supply of the raw material, which is we use a lot of APIs and expedients which comes from outside Sri Lanka. Till the time the supplies of that is not impacted, I don't see much major impact on the healthcare sector happening in Sri Lanka. Currently, if I talk about the biggest impact of this Middle East crisis which has come now is on the mobility sector for us, because the entire supply chain route across the world is disrupted. Tourism into and outside Sri Lanka is disrupted. So the mobility sector, which is our maritime sector and our aviation sector, is something which is impacted. But that contributes to not large portion of our revenues and income, and hence I said it's not a major impact to the group as we go forward.
When you compare the current situation to Cyclone Ditwa, Cyclone Ditwa seems like a very small cog in the bigger scheme of things. But I must ask you this question. Did Cyclone Ditwa impact your FMCG business?
Yes, it did. So if you really ask me, initially when Ditwa hit, I think end of November, we saw a hit on both the businesses, which is FMCG as well as the healthcare business. But healthcare business bounced back very soon. So within a month's time, whatever was the impact was recovered. Whatever impact that happened for the 7 to 10 days in the FMCG business never recovered. So it came back to its original, but whatever the loss which happened in the initial 15 days of Ditwa impacting remained as a loss. While the business came back to the original level, but whatever loss was a permanent loss. And I think that's a difference between the nature of the two businesses that you operate. When you need a medicine, you need a medicine, or probably if you have to go through a procedure, you will postpone that procedure, but you will get it done later. Whereas in a FMCG sector, if you have not used a soap in 7 days, you are not going to use double the soap in the next 7 days. That's the difference in the nature of the two businesses. But yes, the impact happened. But by the end of December, we were back to the pre-Ditwa volumes and values in both healthcare as well as in the FMCG.
What are the evolving trends in the FMCG sector?
FMCG sector, there are 3 major trends which I see evolving in Sri Lanka. One, as we come out of the economic crisis, which happened in 2022-23, people are moving away from a survival mode. So people got into a survival mode and they downgraded their purchases. So they're moving out of the survival mode, which means people are moving from value for money products to value-added products. Second, people are moving away from sachets and now they are going to a large ticket item purchases, large pack purchases. These are the 2 major changes, and then people are doing more discretionary purchases than what they were doing earlier. So if you look at the growth rates, like in the entire FMCG category, which includes food and home and personal care, the category volume grew at about 10%, but the value grew at about 15%, which means people are ready to invest more and give more for the same volume that they are buying, which means premiumization is happening, value-added categories are increasing, brands are coming back into picture. So that's one trend that we have seen. Within these categories, discretionary purchases, which are typically saying deodorants, hand washes, body wash, uh, products which are there, we are seeing a growth which are in very high double digits coming up. And that's one trend that we saw is the consumerism is coming back. Second thing we have seen over a period of time is that now, if you look at the population division in Sri Lanka, now Gen Z is 25%, which is nearly equivalent to millennials. Gen Zs have an access to social media. So they're very much aware about what's happening globally across. They're very aware consumers. They read through every label, they go through every ingredients, and hence they are open to experiment more. They're more demanding than the earlier consumers. And hence the kind of products that or kind of value addition that earlier used to happen, that paradigm has to change. The value addition has to happen more on the new ingredients that you're putting up, what science are you putting up behind your products, and that's what they consider as a value addition, and not living with the past. So that's a second major change. And as more and more Gen Zs are becoming purchasers because they're entering into the workforce, they're earning more money, and they will continue to grow and become more bigger purchasers. This trend is emerging over in the third big trend that we are seeing is more and more women work participation in Sri Lanka. If I give you a statistics, currently only 32% to 35% of women actively participate in the labor workforce. Whereas if I look at the region, that statistics is about 60%. So probably half of our women compared to the regions only are an active workforce earner. Whereas if I look at the education level of Sri Lankan women, we are at par with the region. About 80% of women have an access to higher education. What we are anticipating is that over a period of time, more and more women will become a part of active workforce, which means when they will step out of home, they will require more personal and beauty care products. And that's a trend that we are seeing, and hence this category is growing much faster than the other categories. And most of our strategies for Hemas is around these three major trends that we are seeing on the consumer side. And we were looking at how do we create new products, how do we communicate, and how do we distribute.
Twiga stationers and printers. You got approval from the Kenyan authorities to acquire 75% stake. When will you complete this transaction?
We are in the last stages of closing the working arrangements. Very soon, probably next 2 to 3 months, you will hear the finalization of part. I've always been very skeptical till the time the deal does not happen, because I always believe till it is not done, it's not done. But we are very confident that we'll be able to close it soon now.
And the global scenario is not also helping, I suppose.
As of now, frankly, that hasn't impacted the deal altogether. Is insulated from the impact, pure impact. But yes, as I said, how will this evolve over a period of time will decide. Again, it will have an impact on all the supply chains, travels, communication. But as of now, there's no impact.
The Sri Lankan government's price regulation on pharmaceuticals, how is it impacting Hemas?
So this is not only going to impact Hemas, it's an impact on the industry. So there are two major changes what the government in this price regulation have suggested. One is recalibrating the CIF value of the medicine. And second, recalibrating the margins that an importer or a distributor can have over this. If I look at as this position of Hemas and the industry altogether, if this entire regulation come into picture next year, the industry will get impacted at an operating level at about 20% margin. And if they look at the net margins, the industry will nearly have an impact of about 10%. However, industry is working very closely with both the regulator and the ministries to work out the best possible scenario for the country. And we are looking at how can we continue supplying the best pharmaceutical services to the citizens of Sri Lanka. And whatever the impact that is coming, we are very hopeful that with the reduction of the prices, some demands will go up, and that will cover up for the losses of the industry altogether. Current year, which is going to be there, will be impacted in terms of both the margins at operating level and a net level in the pharmaceutical, not only for Hemas, but as a pharmaceutical industry altogether.
Backtracking on Twiga stationaries and printers, Do you think that this sector will be a better growth sector as opposed to personal care, which you are kind of a leader in
So
Africa?
the bigger question for us is not personal care or stationery. I think what is important for us to understand is why we are going into Africa. So we had been operating in Sri Lanka. Our majority of business used to come or still comes from Sri Lanka. So we have a lot of single market dependencies. As a large conglomerate, we have decided that we want to diversify this risk of ours. And we want at least 25% of our revenues coming from outside Sri Lanka. And under that strategy, we are creating portfolios of markets where we want to go across. Now, when we have to go out, what are the kind of markets we are looking at? So we're looking at markets which has large population, which are growing, and which has unmet demand, and which are typically markets like Southeast Asia, East Africa are those kind of markets where we're looking at. Now, these markets are a little more volatile than the established markets. Working in Sri Lankan kind of a scenario in the last few years, we have stress tested our business model, and we're pretty confident that with our localization approach and our innovation approach, we will be successful in a market like Africa. The stationery market in Kenya and the stationery market in Sri Lanka are very two different markets. And the reason why I say is Sri Lanka has a population about 22 million. Kenya has a population about 56 million. The breakup of the population is very different. Sri Lanka's population is declining at about 0.5% year on year, whereas Kenya population is still increasing at about 2%. When you look at also the age profile, Sri Lankan median age is about 34 years, whereas the Kenyan median age is about 19 years. Now, what does this mean is that Sri Lanka has a population of about 4 million students currently, and which is not growing, which is stagnant. Whereas Kenya has a school-going population of 17 million, which is 4 times of Sri Lanka as of now, and growing. The age profile is 19 years there only. Access to the East African market, which means another access to about another 80 to 90 million student in the East African market. So a stationary profile in Kenya or Africa, East Africa, is actually very different from the stationary profile in Sri Lanka. We should not say that because it's not growing so much in Sri Lanka, it may not be growing. Ambition is that we go into this market, it's a new entry for us in this market, go understand this market, and then at the right time, find an opportunity to even get into the personal care into this market and in these markets. So it's either of them. It's like we could have entered through personal care and would have gone into a stationery, or we could have entered into a stationery, could have gone into personal care. So whatever a good fit that we saw at the right time, we got into that. And next 2-3 years, we establish ourselves there and then find out about.
You mentioned about local pharmaceutical manufacturing by Hemas. Could you please unpack that for us?
About few years back, we pivoted our strategy of doing the own branded manufacturing under Morrison brand in Sri Lanka. If you look at most of the local manufacturers, which are Sri Lankan companies manufacturing in Sri Lanka, typically produce for the government, because government is the biggest purchaser. If you look at the pharmaceutical market in Sri Lanka today, 60% of the consumption happened by the government and 40% is private market. The manufacturing market in Sri Lanka, only 20% is local manufactured. Pharmaceutical drugs are locally manufactured, and 80% is actually imported from outside. And most of the people who are manufacturing medicines in Sri Lanka were mainly manufacturing for the government, supplying to the government. They were not very innovative products. They were like run-of-the-mill products which you require on a day-to-day basis. So that's where we came in and we said, look, we will not be able to make Sri Lankan get the best medicine at an affordable price unless and until we start producing in Sri Lanka. And that's where Morrison came into picture. So we initially identified what are the areas that we want to get into. We identified the best therapeutic classes, which matches the profile of ailments in Sri Lanka. We started with cardio, we got into diabetic products, into neuro, respiratory, these which are the biggest categories in Sri Lanka, and that's where we started producing products. Now we have started producing 12 odd molecules, combination molecules, which are innovative molecules, and some of these molecules are now at the edge of becoming market leaders in its own category. If I look at Morrison on a volume basis, we are number 2 local manufacturer in Sri Lanka. And if I talk about the Morrison branded products, we are the fastest growing a local brand. We're growing at a rate of about 50% year on year. Now, our aspiration going forward is to expand this portfolio of medicines that we are producing, and we only want to introduce the most innovative medicines in Sri Lanka at an affordable. We are in a process of getting a EU GMP compliance, which means through our factory, whatever that we produce, we can even exports to Europe. And once we get this EU GMP compliance, it opens up avenues for us to start exporting our medicines across the world. So that's going to be a step 2 for us. This medicine grows, we will get into other forms of medicines, which is like vaccinations and other stuff. Those are the opportunities, which are the opportunities of the future. So that's where we stand as we.
Finally, Ashish, what is your hope for Hemas Holdings PLC in the medium term?
Our hope is that we really become global player. So currently, from being a Sri Lankan company, step 2 is to become a regional player and then become a truly global player. So our entire efforts in the group is to prepare ourselves to become a really truly global Sri Lankan company, and all efforts are going in future-proofing Hemas for tomorrow. So
thank you very much for the lucid and insightful discussion that we have had and the explanations given, and hope to see you again soon.
Thank you, Dharuta.
Thank you very much.